Hello and welcome to today's topic, patent ductus arteriosus. Understanding the fetal circulation. It allows the oxygenated blood from the placenta to pass directly to the left side of the heart through the foramen ovale without having to flow through the lungs. In fetal development, the heart develops as a single tube which folds back on itself and then divides into two separate circulations. Congenital cardiac malformations include ventricular septal defect, the atrial septal defect, the patent ductus arteriosus, pulmonary stenosis, contraction of the aorta, aortic stenosis, and the Fallet's tetralogy. Patent ductus arteriosus. Atrial septal defects that occur at the site of the foramen ovale. If the foramen ovale fails to close after birth, it remains as the patent ductus arteriosus. Etiology. During fetal life, before the lungs begin to function, most of the blood from the pulmonary artery passes through the ductus arteriosus into the aorta. Normally, the ductus closes soon after birth, but sometimes it fails to do so. Persistence of the ductus is associated with the abnormalities. Rubella infection at 3 months of gestation can cause this congenital malformation. It's more common in females. The pressure in the aorta is higher than that of the pulmonary artery. There will be a continuous arteriovenous shunt. Clinical features include, with small shunts, there may be no symptoms for years. A large shunt in infancy may cause a rise in pulmonary artery pressure, and this leads to progressive pulmonary vascular damage. When the ductus is large, growth and development may be retarded. Usually, there is no disability in infancy, but cardiac failure may eventually occur. Dyspnea is the first symptom to occur. A continuous machinery murmur is heard with late systolic accentuation, maximal in the second left intercostal space below the clavicle. It is frequently accompanied by a thrill. Pulses are increased in volume. Enlargement of the pulmonary artery may be detected in radiography. The ECG may appear normal. Management. A patent ductus is closed with an implantable occlusive device. Closure should be undertaken in infancy if the shunt is significant. This may be delayed until later childhood in those with smaller shunts for whom closure remains advisable to reduce the risk of endocarditis. Treatment in the neonatal period. When the ductus is structurally intact, a prostaglandin synthetase inhibitor like the indomethacin or the brufen may be used in the first week of life to induce the closure. However, in the presence of congenital defect with impaired lung perfusion, that is an undeveloped lung, it may be advisable to improve oxygenation by keeping the ductus open with prostaglandin treatment. To conclude, every human being is uniquely made in the image of God. Thank you.